The golden hour is quite a unique study. As far as we know, there's only one other study that's managed to look at patients within the first hour of injury. And that study was quite small. It only looked at 7 blood samples, and it also didn't look at the function of the immune system. So we know how many cells there were, but not how well they were behaving. The golden hour is going to get round that by looking at 200 patients, and that will really give us some firm conclusions about what's happening to your immune system in the hour after an injury.
So one of the main findings of this study is that we've been able to show that you get evidence of both immune activation and immune suppression within minutes of injury. It was previously been shown in the literature that you do get evidence of immune activation within hours of injury, but it was thought that the immune suppression takes days or even weeks to develop. However, using our unique 60-minute blood samples, we've been able to find evidence of both immune activation and immune suppression before the patient even arrives to hospital. And interestingly, our preliminary data suggests that those patients who have a more active immune response within 1 hour of injury may be at risk of poorer outcome once in hospital. So quite an important part of this study has been our interactions with both the West Midlands Air Ambulance Service, the Merit team, and also the trauma research team that we have here based at the Queen Elizabeth. We've been able to work on a 24/7 basis, meaning that we miss out on very few patients that are eligible to form in our study. It's also been quite beneficial that we've been able to interact between the nurses and also the paramedics in quite a difficult scenario when the paramedics first arrive at the injury scene, and they've been able to take blood samples which we can analyse within 2 hours of the blood samples being taken.
The most immediate implication of the findings of the golden hour study are that we now have a test that can identify patients who are most likely to develop sepsis or multi-organ failure, and so we can treat those appropriately and rapidly.